Well, good afternoon. We're here with Dr. Venkat Rapuri. He is an orthopedic surgeon on the medical staff at Arlington Memorial Hospital, and he just finished up a lecture on arthritic knee pain. And so we actually have a couple questions that came from this lecture, and we were going to ask them to Dr. Rapuri now. So thank you for joining us.
Well, thank you. Thanks for having me.
Yeah. One of the questions that came up, is there a correct age for surgery, and how do I know if I'm too young or too old?
Well, there's no correct age per se. The arthritis that needs a knee replacement is based on the pathology and the X-ray findings. So if you're bone on bone, then you need a knee replacement. So it doesn't matter whether you're 47, if you're bone on bone and hurting, then you need a knee replacement. Is there a too old age? Well, it kind of depends. I mean, I guess if you're active and playing tennis and playing golf and skiing, it doesn't matter whether you're 92 years old, you can still get a knee replacement. So a lot of factors come into making a surgical decision. Age is just one number.
Ah, yes, just a number. That's good to hear. Do stem cells work for arthritis of the knee? That was one of the other questions that came up.
Well, it's a long-winded answer, but the thing is, it depends on the stage. If you're stage 1 in arthritis or stage 2 in arthritis, then yes, maybe the stem cells do work. But even that, there's no scientific evidence that it actually works. And that's the reason why insurance companies don't actually pay for the stem cell injections. It has to come out of your pocket, and most of the places are charging like about $5,000 or so. But if you're stage 3, stage 4 arthritis, probably it's not going to work. It's like expecting to sow some seeds in a desert and putting some water and expecting them to grow into a wheat crop. Not happening.
That's a good analogy. I like that. I was told that I have a meniscus tear with some arthritis. Can I get an arthroscopy instead of a total knee replacement?
Arthroscopic surgeries are done as a keyhole surgery to provide a temporary pain relief. But when the underlying problem is bone rubbing against bone that caused the tear in the first place, it is very likely that these symptoms will not go away despite arthroscopy. So arthroscopic surgery is not an alternative for a total knee replacement surgery. And so that's the reason why, once again, back to this, the issue, insurance companies are basing their data on a research article that was published from Boston, Harvard area that showed that it doesn't make a difference, and so they're actually not paid. And so unless they're causing mechanical symptoms, usually arthroscopic surgery does not work for a knee that has underlying arthritis.
Okay. I have severe arthritis and am getting total knee replacement surgery. Can I take pain meds while I'm waiting for surgery?
Pain meds, that's a big complex word for a lot of things. Well, pain medications, if you're talking about opioid pain medications, probably a bad idea. We are currently running into an opioid epidemic. What studies have shown is that if you take opioids for longer than 5 weeks, your chance of getting off of those opioid medications, even after 5 years, is very slim to none. And so that means to say, you take them for five weeks, you are hooked onto them for the rest of your life. You're depending on them so that you can do your day-to-day function. So I would strongly recommend not getting on the opioid medications before surgery. If you have to take something else, take anti-inflammatory medications, which are available over the counter. Sure. Ibuprofen, Motrin, Aleve, Advil. You know, these medications do provide and are recommended by the American Academy of Orthopedic Surgeons as a treatment option for arthritis. Try those. That would be okay.
Okay, that sounds like a good solution. I was told that I was too sick or too old to have surgery. What are my options?
Well, like I said, I would still go ahead and see the specialist and let him make the decision whether you're too sick or too old, rather than you yourself deciding that I'm too sick, I'm too old, I can't have surgery. Let the specialist make the decision. They're experienced enough. They have done this once or twice, and so they know what they're doing. And so let them figure out whether you're too old or too sick. And if you're truly too sick to have surgery or truly too old to have surgery, there are other options. There's one called Cool Leaf that is available these days. It's called as radiofrequency ablation of the genicular nerves. It can be done as a pain relieving procedure. It's not a permanent procedure. It's a temporary procedure and has to be repeated, but there are options. I would leave it up to the specialist to decide whether you're too sick or too old, and then give you that option if you are truly too sick and too old.
That's great. Well, thank you so much, Dr.
Thank you.
Rapuri. We're so glad that you could join us, and so glad that Dr. Rapuri took part in this lecture series, Being Well. You can find more Being Well lectures at texashealth.org/being-well, and we do them all over the Metroplex. So we hope to see you at one of those or see you back here on Facebook. Thanks for joining us.
Thank you. Thank you so much.